My name is Guru Reddy. I'm the Vice President of Preclinical Research and Development. I do have the unusual background of having a lot of experience not just in clinical but preclinical and other aspects of drug development. The reason I joined this company is because there are two reasons. One is that I knew the background of the lead asset of this company. In fact, I was working on that product when I was at my previous company at Spectrum Pharmaceuticals. That's one thing. But the second part is definitely I looked up Shalabh's background and his medical background, his financial background. I was totally impressed with that. We are a small company, but if you collectively look at the experience of the senior management here, you see that there's extensive clinical development and commercial experience, right? We all collectively come together when there is a big challenge and try to solve the problem in the most expeditious way. In our pipeline, we have two products right now. One of them is treating high levels of phosphate in the blood of patients. And this happens in patients in chronic kidney disease who are on dialysis. It's the end stage renal disease. And the way this drug works is that once food is digested in the stomach, it releases phosphate. That phosphate is bound to our drug, which is a nanoparticle technology-based drug, which is a very high surface area. It binds to this phosphate and forms an insoluble compound, which is then excreted from the body. And that's exactly how it prevents the absorption of the phosphate from the gut, from the GI system into the bloodstream. And the second product in our pipeline has applications in multiple indications down the road, multiple kidney diseases. And right now we are developing that for the acute kidney injury. And this product works on improving the mitochondrial function. Mitochondria is like the power plant of human body, like you need energy to sustain and survive. Usually what happens is that in multiple disease conditions or highly stressful conditions in the body, this mitochondrial pore, it's called MPT pore, tends to open up. When that is open, it's like opening the floodgates. The water is coming into the mitochondria along with other solutes. That leads to swelling of the mitochondria, leads to injury and then subsequent cell death. The way it works is that it activates potassium channel in a mitochondria, which eventually leads to the closure of this MPT pore. Given the fact that it potentially can restore the function of mitochondria, which is so critical for multiple different organs. It can be used to treat kidneys, it can be used to treat eyes or ophthalmic conditions, or cardiovascular conditions, or liver conditions, and a number of other things. Basically, any organ, which requires a lot of energy because of mitochondrial function, we believe we can take this into multiple indications. And, through my work and our, team's work, we're able to help those patients. This is what excites me, and this is what, motivates me.